Hi my friends, let's make fertility simple. Fertility is not just can I get pregnant? It is how the body creates a healthy egg, a healthy sperm, and the right environment for pregnancy, month after month. Today I will explain fertility in a clear way and you will leave with one practical next step. I am Dr. Handan Namlı, obstetric gynecology and fertility specialist. In this lesson, I'll guide you calmly step by step. If you like structured, simple fertility education, welcome to our school community. At the end, I'll give you a downloadable fertility basic sheet you can keep. What does fertility mean? Fertility means the ability to start a pregnancy. But in real life, fertility has three parts: egg quality and ovulation, sperm quality, count, movement, and shape, a healthy pad and home, tubes and uterus lining, and hormones also. If one part of is not working well, pregnancy can take longer. Fertility is a teamwork system, not one single test. The monthly fertility story. Let's walk through a normal cycle. Your brain sends signals, we call this hormones, to the ovaries. One follicle grows and an egg matures inside. Ovulation happens, the egg is released. The fallopian tube picks up the egg. Sperm travels through the cervix and uterus to reach the tube. Fertilization can happen in the tube. Then the embryo travels to the uterus and implants. An important detail: the egg lives about 12 to 24 hours after ovulation. Sperm can live up to 3, 4, 5 days in fertile reproductive liquid. So the fertile window is about 5-6 days. Fertility is not same as perfect health. You can be very healthy and still have fertility challenges. And you have a medical condition and still conceive. Fertility depends on timing, biology, and a little chance. Even with perfect timing, pregnancy does not happen every month. That is normal and not your fault. The biggest fertility factors. First one, age. Age affects egg number and egg quality. This is one of the strongest factors we know. Second one, ovulation. If you don't ovulate regularly, pregnancy is harder. Irregular cycles can be a sign. Third, sperm. Sperm issues are common and often silent. This is why semen analysis is an early helpful test. Fourth, tubes and uterus. Blocked tubes, fibroids, polyps, and endometriosis can reduce fertility. Lifestyle factors: sleep, smoking, alcohol consumption, very high, very low body weight, and severe stress can affect hormones and sperm also. But lifestyle is usually one piece of the puzzle, not the whole story. I want to make a gentle reminder. Please don't blame yourself. We look at the full picture. How do we measure fertility? People ask, how do I know if I am fertile? There is no single perfect test, but we can evaluate the system. Common starting checks: cycle history, regular or irregular, ovulation confirmation, tracking, progesterone blood test, ultrasound, ovarian reserve test, AMH and antral follicle count. They estimate egg quantity, not guaranteed pregnancy. Semen analysis, tube and uterus evaluation when needed. For example, vaginal ultrasound, HSG test. Important issue: test guides us. They don't predict your future with 1% certainty. Your action steps. Here is your next step for this month. Action step: track your cycle with one simple method. Choose one: cervical mucus changes, or ovulation predictor kits, basal body temperature if you like data. Then write down cycle length, approximate ovulation day if you can detect it, any symptoms, pain, spotting, very heavy bleeding. This gives us strong information even before lab test. When to seek help? General guidance is under 35, try for 12 months. 35 and over, try 6 months. Seek help earlier if you have very irregular cycles, known endometriosis, history of pelvic infection, surgery, or male factor concerns. Fertility is a system. Egg, sperm, tubes, uterus, and timing. You are not alone, and you don't need to figure it out by yourself. Please download the Fertility Basics worksheet under this lesson and fill the first page today. It may help to understand your cycle pattern. Here's a common question. What is your biggest confusion about fertility right now? Timing, tests, or age? Please feel free to make a comment. Your question or comment may help someone else. See you in the next video.